Hi, my name is Charity, and I'm going to be a nurse doing an assessment on Gail here. It's going to be a focused assessment of the heart and the lungs. Okay, so we'll go ahead and get started. I've provided for patient privacy by closing the curtain. I'm going to go ahead and wash my hands and verify their identification. Can you tell me your first and last name, please?
Giliana Dali,
And your name and your date of birth?
11393.
Okay, and that's what I have over here. All right, Gail. So what I'm going to do today is a focus assessment on your heart and your lungs. I'm going to start with your lungs first and working from the front to the back, and then I'll go ahead and finish off with the heart. Okay, just want to make sure everything is working properly. And yeah, we'll go ahead and start with taking a look here. And I can see that as she's sitting, she's got symmetrical rise and fall of the chest, rhythm, and rate is regular. I can see that she's not breathing with pursed lips or leaning over to try to breathe. Do you feel dizzy or lightheaded?
No.
Can you show me your fingers? Let me take a look at her nails. I'm clubbing there so I can tell that she's getting good oxygenation. Okay. And have you had a cough or any chest pain recently?
No.
Okay, good. So here we are going to look at the suprasternal notch here, coming down to the sternal angle, and this is the sternum here. And then down here we have where the ribs start to separate, the costal angle. Go ahead and breathe in deeply for me. And by feeling here, I can get a better idea of how she breathes. And it is symmetrical. Okay, so I'm going to go ahead and listen. And then start listening over your trachea for the bronchial sound.
Okay.
Take a deep breath in. Okay, and then I'm going to work my way down, listening to the bronchovesiculars here as ICS 2 and 4, and then 6 through 10 are the vesicular lung sounds that I'm going to be listening to. Take a deep breath. Okay, and lung sounds are clear and equal bilateral. No wheezes, no crackles, and no wails noted. Okay, so I'm going to go ahead and I'm going to quick cut, checking to see if there's any unclear sounds here. Should be resonant sounds in the top, and we'll get down into the bases. It will be a more dull sound because of the visceral organs and things there. Okay, no abnormalities noted. Okay, Gail, so I'm going to have you turn around. Okay, and I'm going to take a look here. You can see the C7, where the spine starts to make a nice slight curve, and then come to the C1. And I can see here, she's got a nice straight spine, no slouching, just normal posture here. You can tell that she puts her shoulders back outward while she's working, making sure to use proper body mechanics. Going down the spine here. Okay. And no abnormalities there. And that's good. No crepitus. Now I'm going to go ahead and have you, as I put my hands down, I'm going to work down your back, and I'm going to have you say the number 99.
Okay. 99.
Okay.
99. 99.
Okay.
99.
And no tactile pelvis movement. I'm going to go ahead and take a listen now. Have you do the same thing when I'm going to listen to you.
99. 99. 99. 99, 99, 99, 99, 99, 99, 99.
Very good. Okay, I'm going to do the same exercise, and I'm going to have you whisper 1, 2, 3.
Okay.
Very good. I'm going to have you do the same thing. I'm going to have you say the letter E. E, 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 Okay, and what we're doing is that we are listening for any clear sounds that would be abnormal, whereas if the lung tissue is good, then we would not be able to hear her speaking as clearly, which is noted. Normal breath, normal sound effects. Okay, Gail, I'm going to have you breathe normally now. I'm going to start listening at T2 at the bronchovesicular all the way down to T6, and then at T8 through 12, it starts to become vesicular sound. Okay, good. I'm going to go ahead and percuss now. Same thing at the front. To the resonance at the top, and more dull at the bottom. And that's what we've done. We have a resonant at the top and more dull towards the bottom. Okay, now we're going to have you go ahead and turn back towards me. Okay, and I'm going to take a look at your heart.
Okay.
Looking to see the jugular, the carotid artery here. I don't see any pulsation on the left or the right side. And then go ahead and just palpate one at a time. Good. Okay, so they're equal. Don't feel any stenosis there. I'm going to go ahead and take a look. And listening to the carotid there, I do hear the bruit, which is the blood moving, but it's not too turbulent. Okay, Gil? going to go ahead and tell you a little bit about the landmarks here that we have. Right coming down, I see S2 right next to the sternum. On the right side of the sternum, we have the aortic valve. Coming across same space in between your ribs here, we have the pulmonic valve. And then down here, 2, 3, 4, 5, we have the tricuspid, which is about here. And then we have the mitral valve, which is down here. And I'm palpating each of these to make sure there's no heaving. Okay, and that's what I feel. I'm going to go ahead and take a listen now. Okay. Okay, so what we're doing is here we're listening for the love dub sound. Now, the dub sound can be heard best here at the pulmonic, which is also the base of the heart. Okay. So that dub that you hear is the closing of the aortic and the pulmonic. And then down here we have the S, we call it S1, and this is at the apex or the top of your heart. And that's where the atrioventricular sounds can be heard when they're closing, when your heart is forcing the blood out. Okay. Okay, out of the atria and the ventricles. So that's what I'm listening for. And regular rate and rhythm. I don't hear any murmurs or any extra heart sounds. Okay. Okay. So what I'm going to go ahead now that I have listened to your heart and I've felt the actual every spot here, I'm going to go ahead and we're going to move down to the peripheral pulses. So we're going to start here with the brachial. Okay. The rate and the rhythm is regular, 2+ quality. Coming down, looking at our hands, feeling any swelling. She feels warm and palpate her radial pulses. Okay, Gil, what I want you to do is go ahead and close your fist, make a fist. I'm going to close this artery here. And in about 30 seconds, I'll have you open them again. We're checking for blood return into the hand through this artery here. And it will turn white, and then you go ahead and open them. And we can see that there is blood flow to her hand. Okay, I'm going to just check here for capillary refill. And there's no issues there. Okay. And the radial pulses are rate and rhythm are regular and 2+ quality. Okay. Okay, so I'm going to go ahead and have you sit in the bed. Okay. And lay down. So we're going to continue looking down here for any edema. And I'm going to palpate from the top of the field, which is what's in for inwardly down
Regular rate and rhythm. 2 plus quality there. Hold my hands here. About 5 seconds. Checking for edema. Feel your fetal pulses as well. Strong fetal pulses. Okay. Good. So let's flow to your feet. And no edema. And continue. For her fetal pulses. Regular rate and rhythm. 2 plus quality.
And lastly, I'm going to go ahead and check for the posterior tibial pulse.
Checking for ankle there. Regular rate and rhythm. 2 plus quality. Checking for capillary refill. Her toes feel a little cold, but she's pink and warm. She can move around some. Your toes always